Hey, what's up? This is Eric, and yeah, I've got some awesome guests with me today. I've got Dr. Elise Cantu and Alex Hill, Dr. Alex Hill also. So yeah, this is the first time I've had two guests on at the same time. So this will be exciting. We'll see how it goes. Yeah, I'm very excited to have these two on here. They're like the big wigs of oncology physical therapy. So I'm very excited to have them on here. And actually, why don't we go ahead and start with Elise? Can you introduce yourself?
Absolutely. So, Eric, thank you so much for inviting us on, first and foremost. That intro video was so rad. I'm like, I need to upgrade my setup now because that was awesome. So, my name is Dr. Elise Cantu. I am a physical therapist. I practice here in Fort Worth, Texas. I specialize in oncology physical therapy. I'm a board certified oncologic clinical specialist and a LANA certified lymphedema therapist, which all that means is I love working with patients who are experiencing cancer and in the aftermath of cancer. And I'm really, really excited to be here and talk about this.
Okay, and actually, Alex, can you introduce yourself?
Yeah, absolutely. So I'm Alex Hill. I'm a oncology and pelvic health physical therapist. I've been practicing for about 11 years, and I'm in the outpatient setting. I'm board certified in women's and pelvic health, oncology, PT, and also a certified lymphedema therapist, a CLT LANA like Elise is. And I treat all genders. And again, just like Elise, I'm super excited to be on tonight.
Like, what's the biggest issue in oncology physical therapy right now?
I think we could say a lot of different things. I would say one of the biggest things is access to oncology rehab and timeliness of that. Too
Ooh.
often we're getting referrals way after the fact. Unfortunately, they're seeing something online or reading something or heard from a friend about the benefits of coming to oncology PT. And this could have been something that maybe we could have mitigated some things in rehab, or at least educated people on way before it even started so that people have a better understanding of what could happen, what their conditions are, and how to effectively manage them and get some more control over that. So I think those would be the two things for me that I would say.
I see.
Yeah. Yep. I would say the same. Honestly, the timely, I think, is such a great point, Alex. The awareness of what oncology physical therapy, what cancer rehab is, and then ultimately being able to access those services in a timely fashion, like I think that puts the bow on the biggest issues that we're facing in oncology physical therapy.
Okay, now I wanted to ask you both. Like,
Mhm.
I know as a brain tumor survivor,
Mhm.
there wasn't really. It was very hard to access those resources.
Yeah.
What is the best way for patients to access everything? Like, do they talk to their physician first, or do they go directly to you?
So one of the great things, at least in the US, is that all 50 states have some form of direct access for
Mhm.
physical therapy. And for OT, I believe that there's a lot of states have direct access as well. So what that means is you don't need a referral to start with physical therapy. If you start to notice that you have neuropathy, lymphedema, balance issues on the pelvic side, bladder or bowel issues, you can at least get that first appointment and start treatment with your physical therapist. Most states, so I'm here in Florida, and we can treat for 30 days, and then we need a provider to sign off on that plan of
Mhm.
care. But you can start right away with PT, like I said, in all 50 states. But to actually find a PT, one, like you said, Eric, like talk with your oncology team first. They should have all of the resources with local therapists that are available. And then choosept.com is another great place to go to. That's from the American Physical Therapy Association, or APTA. That's our national organization. And through that website, you can filter by specialty, by zip code, with what you need for it.
And to add to that, many places where these cancer centers where patients are being treated for cancer, not just the oncology team should have, they're actually supposed to have these resources identified in the community if they don't actually have rehabilitation services, PT, OT, speech therapy available on site. That is actually a requirement to be a center of excellence in oncology in the United States. You have to have those referral pathways. It basically means that the oncologist has to be able to say, "Oh, hey patient, you want physical therapy? Here's where I'm sending you." Like that needs to be a very, very smooth process. Now, the reality, unfortunately, that's not always the case. And so there's tools out there like Alex talked about. Choose PT is a great place to start for physical therapy. And then we have actually, at the cancer rehab community, we've built a tool. We're building a tool that helps patients find physical therapy, occupational therapy, and speech therapy professionals who specialize in cancer treatment, so in oncology across the globe. And that's cancerrehabnearme.com. And like I said, we are building that. It is now actually available for people to use too.
Now, can I ask both of you guys a question? Like, I was wondering, like, what exactly do you do in physical oncology physical therapy? Like, what is the process like? If you could tell, like, some of the people here what it's like, what they actually do there.
So I am, like I said, I'm not pelvic trained like Alex. So Alex is probably going to take it from a pelvic side too. So most of my patients these days are post, they have finished with their cancer treatment. And my patient population, at least right now, tends to be a lot of breast cancer survivors. And so they have finished treatment. They are now dealing with the long term side effects and impairments that have come with that. For them, it tends to be a lot of surgery side effects. They're having difficulty moving their arm. Radiation can cause tightness in this area. Lymphedema is also a big part of my patient population. But as oncology physical therapists, we actually work with patients from the point of diagnosis all the way through treatment, after treatment, and potentially for the rest of that patient's life, whatever that looks like for them. And so it's a lot of assessing, okay, what's happening? What are you experiencing right here, right now? And then we work together to figure out what's most important to the patient. Like, what do you want to be able to do
Yeah.
to get back to or do something new, perhaps? And then what can we do together to get you to those goals is kind of the short version of what we do as oncology physical therapists.
I knew, and this is why I said you go first, because you just tee that up so perfectly for this is everything we do in a nutshell. I love that. So like she said, so I specialize in oncology and pelvic health. So it's a little bit of a unique combination of training. Luckily, there are more of us out there now that do both of these specialties, which is so important because the majority of cancer survivors will experience some type of pelvic issue related to their treatment. And so, for in terms of what people can expect, we're still going to be asking a lot of questions about their symptoms. Did they have these symptoms, for example, bladder concerns, sexual concerns, pelvic pain? Did they have these concerns before they even started treatment? And then now maybe they're getting worse or exacerbated because of the treatment. And then we'll do a pelvic exam. This is not in any way a requirement for people to do. It is recommended because it is going to give us a lot of really great information. But all that means is that we're assessing the tissues. If they had radiation or a surgery, we're assessing what that tissue looks like. How are the scars healing? Is there fibrosis? And then that could be a vaginal or rectal exam where we assess the internal tissues, the pelvic floor strength, the endurance, the coordination. So just like Elise works with a lot of breast cancer survivors and we need to check their shoulder and how the shoulder is working, we do the same exact thing for the pelvic floor muscles and get you started on exercises, treatment, maybe some education or lifestyle changes, dietary things that can be really helpful to address those symptoms. So a lot of people are already dealing with some trauma from the cancer diagnosis itself and the treatment for it, especially for a lot of pelvic cancers. And so they're nervous about even coming in for a pelvic oncology PT appointment or OT appointment. But just know that the patient is always in control. We will make recommendations, for example, doing the pelvic exam, but if you're not comfortable doing that the first visit, that's okay. We've got plenty of other things to look at, just like Elise said. The pelvic floor and the pelvis is just one part of that entire kinetic chain of the entire human body. We still need to look at your posture, your range of motion, your strength, your balance everywhere else with that too.
Now, Alex, I'm curious. Do you see a lot of male patients also?
Yes, yeah, I do. The majority in terms of my cancer population is predominantly prostate cancer.
Okay.
So we'll see some folks before their prostate surgery. Most often we'll see them afterwards. So they'll typically have a catheter in place for 7 to 14 days, and then they can come to see us for some specific exercises or anything like that to regain some of that bladder and sexual function. Those are the predominant male patients that I see for pelvic. Certainly colorectal as well is another population too.
So I'm curious, like what kind of exercises do you do with male patients? Like how,
Anything that anyone else can do. So regardless of your gender, everybody has the same exact pelvic floor muscles. I like to say
yeah.
just kind of different plumbing. And so, if you've heard of Kegels or pelvic floor contractions, and I wish I had my pelvic model right here, it's on the other side of the room. But, you have the pelvic floor, which is a group of muscles that sit at the base of the pelvis. And so if you need to work on strengthening them, for example, to improve sexual function or bladder control or bowel control, then you would want to contract the pelvic floor muscles in and get that contraction. So your bicep is contracting and relaxing. So it's the same thing with these pelvic floor muscles. We're working those muscles and getting them stronger or coordinated. Now, a lot of people think of pelvic PT as only doing Kegels and like strengthening the pelvic floor. But oftentimes, when there's surgery, when there's radiation, when there's difficulty evacuating or pain, then those are the times that we actually need to work on more kind of reverse Kegels and relaxation and mobility. So it's just like with other muscles where we need that mobility and stability. We really need that balance between the two. So that would be the kind of primary exercise that would maybe get, to get people started with. But again, the pelvic floor muscles are part of the core. And so we also need to address those other core muscles. So even working on balance, the pelvic floor muscles are anticipatory. So if we can work on balance exercises, that also works on the pelvic floor.
Yeah.
Glute and hip exercises, abdominal, back, all of that helps to support the pelvic floor as well.
But I was curious, Elise, what kind of exercises do you prescribe for your patients?
Oh man. Like Alex said, there's a lot. It really depends on what the patient is experiencing, right? For my current patients, a lot of who I'm seeing right now, they are dealing with lymphedema. It's usually going to be in their upper extremity, maybe also in their chest and like back and armpit area. And then that also a lot of times, these patients are also experiencing weakness in that same arm, and maybe even some like flexibility restrictions and whatnot. And so we do a lot of strengthening exercises, not only to, obviously help with the weakness, it also is beneficial for the lymphedema. That the swelling is actually helped by that muscle contraction. And it also helps to, just a lot of my patients, maybe after going through cancer and cancer treatment, maybe their bodies have changed, maybe they've gained some weight, and this can also be a way for them to kind of put themselves back in the driver's seat of helping to control their weight, but also kind of be in the driver's seat for their overall health. So like I mentioned, we do a lot of strengthening exercises, lots of upper body, lots of lower body too. Balance is a big thing, like Alex mentioned. Huge problem that I see in a lot of my patient population. So those are kind of just like very general categories of exercises. but there's a lot. There's a lot of fun exercises to do out there.
Now, can you guys tell me? I think you were some of the first board certified oncology physical therapists. Like, what was that process like?
I'm gonna let Alex take that one first.
Okay.
So I'm double board certified in women's health and oncology. What's interesting about that is the hours, you can't double dip on the hours. And so when I had applied to sit for the board certification exam for oncology, I was a little short on the hours for oncology, even though my caseload it fluctuates, but it's kind of 50-50 between pelvic and oncology. So I didn't sit for it the very first year, 2019. The process for studying for it, so I also did a women's health residency at Duke. That was my first year after I graduated. And so studying for boards for the women's health exam compared to the oncology exam was completely different because I'd had that year-long intensive residency in women's health, and it was more just making sure I knew the specific topics versus oncology. I had to really go out of my way to shadow other therapists in acute care, to shadow with other specialties and disciplines. So I really became more rounded versus I primarily see, these pelvic cancers, breast cancer, head and neck cancer in the outpatient setting. I didn't have as strong of a background in the acute care setting because I just didn't treat in that area. Yeah. So I studied for probably about eight to 10 months for the exam. And then I will never forget Friday the 13th in 2020. I got out of the exam and it was, I was excited. I was like, all right, I finally took the exam. I'm going to go with my husband. Like, we're going to go celebrate. I had text from him as soon as I came out after this grueling, Elise can say to talk about it too, like a grueling exam. And he said, everything in the state is shut down.
Okay. Okay. Wow.
So that was how my oncology exam ended. Luckily passed, so it was all good. But it was just it was a little lackluster celebration afterwards compared to what we were planning.
That's unfortunate. That's what a big bummer. I mean,
compared to maybe that year, that was okay.
You made it. Like, we're good. So I am only a board certified oncologic clinical specialist. I don't have any board certified.
Take out the only.
One's enough. One's enough for me. I don't need any more. So I took the exam the year after Alex. So I'm part of the third cohort that went through this process. And so I was really able to lean on and learn from those who went before me. Alex was a big person. And there are so many others in the oncology field who were really helpful in this. And so I think by the third round, they had kind of figured things out. Like, there was a plan, there was a system, not that there wasn't previously, but I feel like there was more of a set process that I could then learn from the other clinicians and then go into this process. I still studied for, I think, 8 to 10 months, like Alex had mentioned. Started in summer of 2020, which that was fun, COVID and everything. And then I sat for my exam in spring of 2021. I'm extremely proud to be a board certified oncologic clinical specialist. But the process of studying for that exam is what ultimately really catapulted my knowledge and confidence in being able to treat this patient population. Like, I could do that previously. I knew I could, but I think that's what really transforms someone into a specialist in oncology physical therapy, in my opinion. So I think it's a really valuable experience. It was really transformative for me. And ultimately I was really excited that I did pass the exam and become a official board certified clinical specialist. But that, I think, really helped solidify, like, this is what I want to be doing. I knew that already, but I was like, oh, I really like what I'm doing and learning, because I'm just obsessed with, like, this topic area and working with these patients. So yeah, that was my experience.
I see. Now, Alex, I do want to ask you, like, how did you develop interest in oncology physical therapy?
So when I was in PT school at University of Florida, go Gators! Got to get that Gator chomping. Not doing so hot with football, but
I gotta throw a go blue in there too. Then so yeah.
So when I was in PT school, I was in an outpatient setting of, doing my clinical rotation, and it was the orthopedic setting, but there were also pelvic health therapists there. And several of them also worked with the oncology population.
Okay.
And so my clinical instructor was out for a couple days, and I wanted to shadow, I just wanted, what do they do behind the doors? I hear laughing, I hear crying, people just seem like a whole different person when they come out. What do they do?
Yeah.
And in class, we'd really only had maybe a couple hours of each pelvic health and oncology, and it was more red flags and that kind of thing versus actual excitement and treatment for it.
Okay.
Mm-hmm.
Yeah. And so I shadowed with them, and I just remember my mind being blown. Why isn't this one part of our curriculum, which that's a whole other story in general for PT schools, but also it's just I have to be in this. When I was in PT school, pelvic health and oncology were the only two topics that I continually sought out additional reading for and shadowing hours for beyond what I needed for residency or, to graduate or that kind of thing. I was just immediately hooked. The strength of the survivors and the resilience, and they're not these fragile patients that we're almost taught that they are in PT school. There's so much more, and I wanted to be part of that.
Now, actually, Elise, how did you get involved in oncology physical therapy, or what sparked your interest?
Yeah. So my interest in oncology actually started from home. So growing up, my mom was an oncology nurse and my sister went on to become an oncology nurse. And so cancer was weirdly a dinner conversation. My sister and I expressed interest in, what our mom did early on, but it wasn't until I was actually in PT school that I was privileged enough. My undergrad mentor, which y'all are repping your schools, go Frogs. I'm a Horned Frog. My mentor, Dr. Phil Esposito, took a gaggle of us first-year PT students to CSM, which is our big physical therapy conference. And I just happened to stumble in to an oncology physical therapy session. It was a session that was just what is oncology physical therapy? This is what we do. And there is Elise before this session, and there is Elise after this session, because that session is where I learned, oh, I can be a physical therapist and I can leverage this interest, this passion for oncology together into a career because others are also doing that. And so that's really what sparked my interest. And so when I came home from that conference, I told my PT school, I said, I don't care what you have to do. I have to do a clinical rotation in oncology, which I was fortunate enough to be able to do. And the rest is history.
Very cool.
Yeah.
Now, I just want to ask you both, what exactly are you guys doing now in oncology physical therapy?
Take it away, Elise.
Oh, I'm really excited for Alex's answer because I know a little behind the scenes. So I have a private practice here in Fort Worth, Texas called Fort Worth Cancer Care, where I work with patients before, during, and after cancer treatment. I also have a small business that I run called the Onco PT, where I teach other physical therapists how to treat patients with cancer because there is a severe lack of us. We need way more physical therapists who are equipped and excited to treat this patient population. And then I also do a little more teaching at my alma mater, TCU, in the kinesiology department, where I teach pre-physical therapy students. So I'm just getting all my fingers in all the areas to try and influence more physical therapists and future physical therapists to get into oncology physical therapy. So that's what I'm up to these days. I would love to hear Alex's answer.
So I currently work full-time with a hospital system. I've been in practice for 11 years. I've always worked in hospital systems, but I'm actually going to be opening up my own clinic in a couple weeks. This is actually my first time in my clinic, like working, which is amazing. It's really cool. So that's been really the biggest thing for me, oncology wise, is opening up a clinic where I'll be treating pelvic health, oncology, lymphedema, lipedema, gender affirming care, just really inclusive space for everybody that needs that help, like Elise said, kind of before, during, after treatment. And then I have a side business, Oncopelvic PT, which my clinic is through. But I've been running this business since 2020, and I do primarily online content. And then I also do continuing education courses for clinician. Like Elise said, there's such a gap in clinical education for these specialties that shouldn't be that specialized.
Yep.
Because the majority of people are going to have some type of pelvic floor condition. We have millions and millions of people each year more that are getting diagnosed with cancer and now living longer and living with cancer as a chronic condition.
Yep.
Why, like, so, me and Elise have recognized this along with other therapists and saying we need to do better. So let's do better. And so I'm doing these continuing education courses as well. I'm active with APTA, the national organization, and then I've been involved with APTA, the oncology and the pelvic health sections as well. So like Elise said, just finding ways to get my hands into everything to just keep advancing oncology and pelvic health forward, because we need clinicians to be better equipped to work with patients, and we need people just in general, including other therapists and healthcare providers, to understand what we do. It's more than just, easy peasy resistance band exercises. It's more than just Kegels. It's so much more robust than that. And if people can understand that, again, both on the patient side and the therapist side, this is just going to elevate everybody's quality of life so much better.
Yeah, I totally agree with you there, Alex. Because yeah, I think patients need to know about oncology rehab, and honestly think social media is probably the best way to do it. Because that's great for the younger generations. But I'm trying to figure out how do you reach those older patients? What do you think is the best way to promote oncology physical therapy?
So, I mean, based on the metrics and insights with like my social media channels, Facebook is still, kind of the older demographic.
Yeah.
YouTube and Google. So again, it's just putting out consistent information, and we just need to increase the accessibility of it. So I think that's the first thing, is just going to where people are going to be looking for it in whatever target demographic we're looking for, like you said, including the older population, but also reaching out to, kind of key companies or stakeholders and advocating more for oncology rehab and talking with primary care providers and, these kind of and family providers, like these first level providers who people are coming to with their initial concerns. They might be 10, 20 years out from their cancer diagnosis, but you're 10, 20 years out, you can still be having issues. If not, they're already starting to worsen, or could be getting exacerbated, like cardiac issues or pulmonary issues. If you had, these toxicity side effects from chemotherapy or radiation. So long-winded answer, but essentially, is hitting some of those kind of key target social media outlets, and then working with kind of some of these frontline providers.
I'd like to call out actually something that Alex said in her answer, which is consistency. That is the name of the game. That's the nature of the beast when it comes to social media. And this is coming from someone as a content creator. Like, if whatever platform that we decide to show up on, we need to be consistent. And that's really, it's much easier said than done. So as much as I'm saying this to like someone listening, this is also to myself, of like, consistency is how we are going to, as healthcare professionals, increase that awareness. I find that in my the patients that I'm working with, they have to increasingly be their own advocate more and more and more. And so they're going to places to find this information in order to advocate for themselves, to educate themselves and to advocate for themselves. And so we, as the healthcare professionals, need to be on social media and talking about this so that the person who is looking for this information has a accurate, reliable, trustworthy place like Alex, one of, I think, the best, patient-facing oncology and pelvic floor resources out on the internet is Alex, right? And we mentioned off air, Eric, we were talking about Kelly Sturm also. Like, there are some really strong voices who are having these conversations, who are talking online, but there's not enough of us. It's awesome that I know so many cool onco PTs on social media. It's a bummer that there aren't more for us to know, to be making these, connections and to share this information, because patients, I think more than ever, are in a position where they have access to this information, but they also have to do the advocating for themselves to even get in the door, from their oncologist office to like the physical therapist office, for example. So like, yay, we need more. We need more.
I'm gonna kind of change gears a little bit here. Like the main goal of this podcast is to kind of humanize the cancer experience, and I think it's very important to highlight the healthcare professionals as well as the survivors. A ton of random questions that I'm gonna ask you, and this is to kind of get to know
You
the
can always
individual,
answer first.
right? Okay.
Watching you.
All right. So first off, what is your personal theme song?
Honestly, I don't know that you could have asked me a harder question, Eric, because I really enjoy music.
Yeah.
Honestly,
Oh,
if
really?
I'm just picking some songs like at random that are vibes, Pink Pony Club by Chapel Roan always hits. Golden from K-pop Demon Hunters, absolutely
Okay.
transformative. Gosh. This is a very challenging question. Those are my theme songs for now, Eric. Ask me
For now.
next year, they'll be different again, I swear.
Okay. Okay, then you, Alex, what is your personal theme song?
So I would say Get Back Up Again from the movie Trolls.
Okay.
Because it's just super poppy, happy, and just like, we're just going to get back up and do it again. So I love that one. My poor husband had to listen to that soundtrack on repeat so many times. And then Shake It Off. I've been a Swiftie since like 10th grade, which is a lot of years ago. But Shake It Off was actually my walk-up song for a conference last year.
Really? Okay. Wow. Okay. I did not know that. Shake It Off. Okay. All right. I'm going to go on to the next question here.
I hope this next question is easier.
So, who is your personal hero? And we'll start with you, Elise. Oh, you want to start with Alex? Okay.
I mean, Alex is a really powerful one. Absolutely.
We're both going to say the same one, I bet.
Honestly, there's a lot. Eric, you ask really wonderful questions. This is the problem, is you ask wonderful questions. I think there's too many to honestly name. Like within the oncology space, Alexandra Hill, Kelly Sturm, Scott Capozza. Like, oh my gosh, there's so many that are personal heroes of mine. I think maybe more on the personal side of things. So my grandmother, Granny, RIP, she just recently passed this summer. She had cancer 4 times. And it just could not knock her down off her game. And so it was really interesting to see, because she was diagnosed for the first time when I was 16 years old, and then over the years was diagnosed again. And so seeing that journey for her and what that looked like, and also parallel with my own journey of, going through high school and college and then PT school and becoming a professional has been really interesting. And so like a personal really high moment for me is when I got to give her a signed copy of my oncology pocket guide for other physical therapists. Like, that was such a high point for me. And so, like, Granny is absolutely one of those up there for me. And then my husband's pretty cool too. He's a cool hero. Okay, next. Go for it, Alex.
Alex, you get the stage.
So Scott Capozza, hands down.
Yeah. He was actually on here.
I know. Yeah. He is one of the most giving and resilient people I've ever met. With his time, his energy, his resources, his knowledge. I could do a whole podcast just about how much everybody loves Scott Capozza. I mean, he's incredible. And not just what he is, but also his advocacy and how he encourages others and equips others to advocate not just for themselves, but for the profession as well. So he's been a big one in oncology. And then Dr. Meryl Alapatu, so she's at UF. So she was one of the first pelvic therapists that I shadowed. Helped with me with getting my case report and a poster submitted to the first CSM conference, has really helped to elevate me in my first couple years out as a new PT with getting involved with research and how to write a paper and being a co-author. And we still are collaborating to this day on a CPG right now. So she's just been absolutely incredible. And then on a personal note, I would say my older sister is a force to be reckoned with. She is fearless. She's a author. She's an award-winning author. She's self-published her own books. She learned how to do it on her own. She has 2 full series out, and she's getting a master's on top of another. Like, she's just absolutely incredible. And again, another person that's just always shows up for her friends and family. So those are, I had to choose 3. My husband's also pretty cool too, like Elise said. Gotta throw in the hubby.
Okay. All right. Next question. This is for Elise. We'll start with you. What is your favorite hobby?
I was thinking about this question earlier today, which is so weird. Like, it was not queued up. I love mysteries. I love reading about them. I love solving them in whatever capacity. I love watching them unfold. So, like, mysteries, I think, are my big category here. And then I don't think a lot of people know this about me. I really like gaming. I am a fiend for Horizon Zero Dawn and Horizon Forbidden West series. That is my wind down hobby. Absolutely.
Gotcha. Okay, Alex?
I don't even know how I'm gonna follow that.
That's pretty shocking, I'll admit. So yeah.
I love hiking, which is, now that I'm living in Florida, I'm not from Florida, but to go from like mountains in the Carolinas and Maryland to like Florida, I'll still say hiking and traveling. And I'm a total foodie. My husband and I enjoy, like, each weekend, like, trying a new place, and just like these little hole in the walls. Like, we had amazing Ethiopian like a couple weeks ago, and then we had Philippine. Like, it's just, I just love being a foodie. So eating and activity are my hobbies.
Okay. Actually, this question is for both you guys, and I'll be very impressed if you can get it. In mathematics, define coefficient.
Oh my god.
Oh, my husband has a PhD in physical chemistry, so I feel like he would be very disappointed in this. It's familiar. I have no idea. I don't even know that I could take a guess.
Okay,
I don't.
Elise,
I genuinely. I know the word, like coefficient of, and I don't know what it actually means. To be honest.
Feel like as soon as you say it, I'm gonna be like, oh, that's what it is.
Yeah.
Okay, here's the definition. A coefficient is a number that is multiplied by a variable.
Oh.
That is, a number being multiplied by a variable, such as x, y, or z, is called a coefficient.
Oh,
has
okay.
left me a long time ago.
Yeah.
All right. Next question, and we'll start with you, Elise. Coffee or tea? Tea?
Period.
Okay.
Yep.
Hard stop.
And and Alex, how about you?
So I didn't drink any caffeine really until I got to PT school, and then it was green tea. And then now apparently I just went from like Earl Grey to I love black coffee now. Like in the last year. I love it. Decaf, half calf, iced, hot, any type of just black coffee. It's my jam.
Interesting, because I think I'm getting to the age where I can't have coffee past 5 o'clock because I'll be up all night. So I can't do coffee anymore.
I feel like I can't have coffee past like 8 a.m. So
Okay.
I have enough energy.
Okay, next question here is, what is your favorite website? And we'll start with Elise. Your favorite website of all time.
My favorite website of all time.
This is the hardest one, I feel like.
This might be the hardest question.
Yeah.
Honestly, you know what? Google or the search capabilities. Like I talked about mysteries earlier. I feel like Google can help me answer some of those mysteries, and I do a lot of research for my work. So I feel like it's my friend. It's a starting point for my research.
Okay, gotcha. Yeah, and Alex, how about you?
Honestly, I was thinking Google too, because it's just the gateway to everything else. I mean, if this was years ago, then it would have been like Ask Jeeves or like whatever search engine there is.
Okay. All right. Okay, next question here. Movies or TV shows? Well, we've got 4 more questions. I've only got 14 questions for you.
Dang.
Okay, TV show if I need to binge, movie for date night.
Okay.
Oh, that's good. I think I emotionally can commit to the arc of a TV show more than I can a movie.
Okay. All right. Okay. Another one here. Dogs or cats?
I'm curious on Alex's answer.
I know. I grew up with both, and now I only have plants. So I feel like I'm going to say answer C, plant.
Okay. All right.
But I love dogs and cats. I never pass up the chance to pet one.
I am a dog owner, so I'm going to put dog on this one. But I'm not opposed to cats. The dog is in the room with me. He might be upset if I answered otherwise.
Teddy would be a little offended.
Yeah.
All right. Just a couple more questions here. Eating out or ordering delivery?
I like the experience of going out and ordering food and, having the experience of eating.
Okay.
I would say if I had to choose one, eating out, unless it's rainy and yucky, and then Orion's going to be the best as we binge.
Okay. All right. Next question here. This is a very controversial question.
Oh, my gosh.
So I really am interested in what you guys say.
I'm so curious.
Okay. Pineapple on pizza. Yes.
Oh my goodness.
With mushroom.
I understand the controversy now.
Yeah.
If you had asked me a year ago, I actually would have been a no, but I think as I've gotten older, I have come to appreciate the flavor of pineapple on a good Canadian bacon pizza. Like, there's something about it.
Okay, I've got a couple more questions here. Like, okay, we'll start with Elise. Where's your favorite place to travel?
Oh man. I really enjoy visiting Boston and Chicago. I think they are really, really cool cities. I've had really cool experiences. If I had to pick one, I think it would be Boston because there's the food element. Like, I love seafood. So I think that's probably one of my absolute favorite places to go.
Okay. And Alex?
I would say Iceland is my favorite place. I've been there twice. Last time that I went was when I got engaged, which was so cool. It's on a black sand beach because it's, volcanic island. We're also in an earthquake there, so that was an interesting weekend.
Okay.
But like the landscape, the people, the culture, the food, like the architecture, like everything is absolutely incredible there. It's probably my favorite place to go to.
Nice.
Okay, and I've got one last question here. Uh, any words of advice for people with disabilities?
As tiring as it can get and frustrating as it can get is to keep advocating for yourself, but don't necessarily feel like you have to do it alone. Find others who can support you, or other people that are already doing something, or find that healthcare. Like my patients know, like I don't like saying a bulldog because I don't like Georgia, but I am a bulldog for my patients. Like if you need to come after some insurance, like we will get you what you need. Like but like finding other people to help you advocate for yourself. Get somebody to help hold the microphone for you to amplify what you need.
Mm-hmm. Alex, you can be a bull gator. Okay.
Oh, I like that.
Not a bulldog.
Okay.
Yeah.
Okay.
Yeah. That way you're saved. I'm not gonna lie, my advice was probably going to be along the same lines, I think. And I don't want to say this from a perspective of like, you have to advocate for yourself. This person listening to this already knows that. Like, you have to advocate so much. My patients have to advocate for themselves so much. But I think what Alex said about finding those people to be on your team to help advocate with you and for you is a really important part. And so that's what I hope that my patients say about me, is that I am also an advocate, and that I am on their team and I am helping encourage them in the corner and advocating for them. Gosh, I don't have an original thought here. I'm sorry, Alex. I'm just like, yes to what she said. Yes.
You threw in the bull gator, so we'll take that.
I'll be a bullfrog with you.
Actually, I was just checking Facebook, and there's one question in here.
See that?
Do you feel that the medical and biopharma companies are adequately integrating your specialized type of physical therapy into their medical treatment continuum? This is from Junius Hill.
That's my dad.
Oh my God, really? Hi, Dad!
Hi, Dad.
Okay.
I would say in general, yes. I think that especially now that across different types of diagnoses and specialties, there's more research on the benefits of rehab and the need for conservative care as we go through the algorithm, right? So these companies have these algorithms that then, the physicians or the medical providers are then implementing. And rehab should be part of that. And I think that a lot of companies are also recognizing that their device or their medication also works really well with rehab. Right? So a lot of these conditions, especially these chronic conditions, oncology, it's not just one magic pill, although rehab is pretty magical. But it's multimodal. We typically need multiple things. And so I do feel like in general, pharmaceutical companies, device companies are integrating rehab pretty well.
Okay, I'm going to be controversial and disagree here. And this is based on my experience. Alex and I live in different states, right? We work in very different areas as far as like what Alex has seen is not necessarily what I've seen. I don't think in general that medical companies, the healthcare industry is really leveraging what physical therapy, especially oncology physical therapy, can do for patients. Like Alex mentioned, the research is extensive when it comes to the benefits of oncology physical therapy and what it can do for a person before treatment, during treatment, after treatment, and for the rest of their life, when it comes to improving their mobility, improving their independence, improving their quality of life, and sometimes even improving their their body's response to treatment, and maybe even their outcomes, like from a survival standpoint. It's not a blanket statement, right? We can't apply this to every person with cancer, but we do have really strong evidence that supports that sometimes, in certain cases, certain diagnoses, certain treatments, patients who are physically more fit are more likely to survive their cancer. And we know that patients who are physically active after a cancer diagnosis are going to have a better life expectancy and potentially quality of life expected out of that. So I don't think that medical companies and, healthcare in general and our culture is adequately leveraging and using and getting patients connected with oncology physical therapy to see these kinds of benefits. So sorry, Alex, absolutely. No, I don't think so. We have a lot of work to do. We have a lot of work to do as a community. And I'm not just saying medical do better. It's also on us. It is on us as the physical therapist to make sure that we are out there. We are talking about this. We are getting connected. We are also helping patients get connected with our services so that we can see these benefits.
Yeah, I totally agree with you, Elise. Really think there needs to be like a stronger collaboration between the patient and the healthcare provider, because yeah, the impact of that would be phenomenal. Yeah, again, I just want to say thank you guys for participating in this. Like, I really like this format where there's like three people just kind of like hanging out. So,
This
yeah,
was great.
really appreciate it.
This was fun. I really like this format too. Very, very easy, very
Yeah.
fun. Loved
Yeah.
it.
Okay, cool. Well, yeah, next week we got a couple more oncology physical therapists. So, stay
Awesome.
tuned and yeah, look for updates on social media.
Very cool. Thank you so much,
Thank
Eric. Appreciate
you,
it.
Yeah,
Eric.
thank you guys
Yes.
for coming. Yeah. All right. You guys have a good night.
Thank
Thank you. You
you.
too.